Okay, it looks like it's just about 12:30, and our room is filling up, so to speak. So we're going to get started. Just a few quick housekeeping items. As typical, all lines are muted. Questions can be sent, in. We already have a fair amount of questions that were pre-submitted, and we're going to do our best to get to all of them. If for some reason we can't, we'll certainly be following up with people directly one-on-one. So one question was, is there going to be a handout? This handout that you see right now is predominantly some contact information for Scott Dardick and myself. But as far as, being able to submit questions, there is on kind of a touch screen device like an iPhone or an iPad down here in the settings. There's a question opportunity on a desktop up in the upper right-hand corner. The little orange arrow will bring up a button for you to ask questions. And then there's also a handouts section where you're able to download essentially what I just showed you, predominantly so that you'll have contact information for Scott and myself. So with that being said, I'd like to introduce Scott Dardick. Scott is a Medicare benefits consultant for AIA, member of the Alegra Group. He represents numerous companies such as Humana Health, Health America, Geisinger, Capital Blue Cross, Aetna, and Highmark, and focuses solely on Medicare. So we're really fortunate to have Scott with us because he truly is an expert in the field. Personally, I'm Brad Newman. I'm a certified financial planner and advisor with Roof Advisory Group, a division of Fort Pitt Capital Group. So with that, let's kind of get into things. Scott, maybe a good place to start would be just kind of reviewing some Medicare basics. And I should say that Scott does have some tables and charts and things that may be useful from time to time as we chat, that I'm going to actually kind of turn the screen over to him so that he's going to be able to pull things up as needed. Say yes.
All right, thank you very much, Brad.
You're welcome. But let's maybe kind of start with, if you could give us maybe a brief history of Medicare, kind of how we got to where we are with the program today.
Sure, absolutely. Thank you very much. Yeah, so Medicare, original Medicare started in 1965. And original Medicare comes in two parts, Part A and Part B. And if I can here real quick, let me bring up just the card here, a sample Medicare card, because for anyone who's either on Medicare or if you've never seen a Medicare card before, this is what it looks like. The original Medicare is Part A and Part B. Part A is labeled hospital, Part B is labeled medical, and we'll go into more detail in a second. But the program started in 1965. It has had a lot of changes through the years, but this is original Medicare.
Scott, your audio is getting a little in and out. I'm not sure.
Oh goodness, I'm not sure. Let me try. See if I sit closer here. Is this better?
Yeah, it's a lot better.
All right, sorry about that. It's probably because I moved it. Yeah, thank you. So yeah, that's when original Medicare started. It was back in 1965. A lot of people think it went a lot further back than that. And if you want a little bit of trivia, you know who got the first Medicare card?
No. No, I don't know. Yes, I want the trivia.
Harry Truman and Bess Truman got the second. So.
Oh, interesting.
A little bit of trivia with it, but yeah, that's when Medicare started. So.
Okay.
And you have to be 65 or older it was what it was originally designed for. But you can be any age, and I'll go through that in just a moment as well.
Okay. Now, Scott, I know a lot of our clients are interested, especially from a tax perspective, in kind of monitoring and controlling their income because of the tiered premium nature. Can you chat a little bit about kind of the earned income component
Sure.
and explain how that impacts premiums?
Yes. So original Medicare, Part A is free if someone's worked, your spouse has worked 10 years or 40 quarters. Part B, there's a premium, and the premium you pay is income based. And so here's this chart I'm putting up now shows you the current rates and what you would pay. So that green top line where most individuals fall. If you're a single individual, you make $87,000 a year less of modified adjusted gross income. Or if you're a married couple, it's double, $174,000 a year less. You'll pay $144.60 a month for Part B. If you earn more than those amounts, you can see the table and you'll see all the 5 other levels. And if you notice on there, you'll pay more for not only Part B, but also Part D or prescription drug plans, which we'll talk to. They will actually add in addition to whatever that premium is based on your income. So these are your starting costs to Medicare. So what Medicare does is when you first come on to Medicare, they're going to pull your tax returns from 2 years ago. So currently they're using 2018 tax return. That's what they're going to look at, and that's how they're going to determine how much you're paying. Now, when you're drawing Social Security, they're going to automatically take this out of your Social Security check. You don't have a choice. That's automatically how they're going to collect it. When you're not drawing, they're going to charge you 3 months at a time or a quarter at a time in advance. So you're going to be paying 3 months in advance at a time for this. Now, the additional, if you're in the higher income brackets where you're paying more for Part D, that additional premium will be collected through whatever drug plan carrier you sign up with. They'll be charged with collecting that amount, but Social Security will take the Part B payment direct from you.
Now, Scott, if you've got, let's say, your income gets a little lumpy, maybe you've got 1 year where, let's say you've retired, maybe there was a bonus at the end, or, kind of an unusual circumstance, maybe to pay out of a deferred comp plan, something that isn't typical. Are you able to appeal that or go back and make your case as to why that's not normal?
Yes, that's a very good question. Absolutely. So again, they're going to start by looking at your tax return from 2 years ago, but there is an appeals process. If you are earning lower and you're retired or something's changed in your life that you're not going to be at that level, you can appeal this and get it lowered. But likewise, if your income ever goes up, and I've had that happen where clients, something else happens, some windfall or something, where they jump to another level, you have to stay on that for at least a year. And then if your income falls back down, then you can drop back down, but it's at least a 1 year. If you do not, Social Security or IRS will find it and automatically change it, but it may take a while. So you're better to be proactive, certainly if your income went down.
Yeah, gotcha. And as far as the plan itself and enrolling, I think everybody knows that Medicare starts at age 65. Everybody's, anxious to get to that age. But can you, share a little bit, how enrollment works, and maybe specifically, are there penalties for enrolling late? And maybe how do you handle things if you're still working at 65?
Yeah, all of those are great questions because this comes up a lot, especially now with more and more people working past age 65. So you're originally normally eligible for Medicare. If you're turning 65, you're given a 7-month window. You have 3 months before the month of your birth, the month of your birth, and 3 months after. That's your window to enroll into Medicare. If you wait past that period, if you wait past that 7-month window or 3 months past the month of your birth and enroll, you could be subject to penalties for Part B and Part D prescription drugs, which we'll get into more detail later, but both of those can carry a late enrollment penalty. Now, there are exceptions to that. This is one of the first real big confusing ones, is that if you are 65 or turning 65 and you are still employed and you plan on staying employed or stay with an employer, you can not take Medicare A or B and pick it up at any time later, 70, 75, 60, whatever age passed, with no penalties, only if you work for an employer with more than 20 employees. So this is where the confusion comes in, because a lot of people think, I'm turning 65, I must sign up for Medicare, I'll be penalized. Well, that is true. If you work for a company with less than 20 employees, then Medicare is primary to your work coverage. So you must get Medicare in this 7-month window or you'll be penalized if you get it late. Not true if you work for a company with more than 20 employees. You do not have to take A or B, and we'll talk more in detail of some reasons why you might not want to. But You can stay on the company plan as long as you'd like. You can work till whenever, and whenever you leave it, you can pick up Medicare A and B and D with no penalties. As long as you've had what's called creditable coverage, which most employer plans are creditable coverage. In fact, if they're not creditable, they must by law tell you that to give you the option to enroll. But most, it's not very common that we run into a non-creditable plan. Almost all of it is.
And Scott, those employee thresholds, does that differ whether you're an employee of a company or whether it's your company?
It's for that distinction, if you're the owner of a company, you must have 20 employees.
Okay.
Or more. If
right.
So, if you're, it's whatever they don't always have to be full-time employees. Part-time employees can count toward businesses, and there's businesses that are always constantly on the threshold of 20 or below. And what happens is a 1 year grace period. If you fall below 20, you get 1 year to see, and if you don't go back up the threshold, then you've got to enroll in Medicare, you're going to be penalized.
Okay. Okay.
Catches a lot of people because a lot of people aren't aware of these little nuances, but that's so. Now you can also be, as you see on the slide I have up, you can be any age and get onto Medicare if you've had a Social Security disability for 24 months or 2 years. Then any person of any age can get onto Medicare. But it's primarily been designed for the 65, and that's where most people are.
All right. Now, Scott, you've mentioned Social Security a couple of times, early on in the presentation about how premiums are collected. Other than that, does your Social Security status impact your Medicare status?
No, good question. If you wanted to draw Social Security, which someone could do as early as 62, it doesn't impact Medicare. Even though you do get both of these things through the Social Security office, because actually you obtain Medicare through Social Security. That's where you ask for it from and where you first apply for it. But they are two different events. You can start Medicare without starting drawing Social Security. You can draw Social Security and not go on to Medicare. So it's totally independent.
Okay. Okay. Now, a lot of people have HSA accounts, health savings accounts, and it's become very popular to, while you're working, really fund them, but not use them for current healthcare expenses to kind of build a war chest for post-retirement healthcare expenses. How do HSAs impact or work with Medicare?
That's a very good question. So I'll bring this slide up for health savings accounts, because more and more companies are going to this, because what an HSA account, health savings, it's a high deductible plan, but you're allowed to put pre-tax dollars into a bank account. You or the employer can make a contribution, and you can use that toward your deductibles and copays and so forth. So under Medicare rules, you cannot have Part A or Part B and contribute pre-tax dollars into that account, either you or the employer. If you do, you're going to pay income tax on that money plus a 6% excise tax on top of that whole amount. So this has been a problem. When I said earlier, a reason why you might not want to take Part A or Part B when you're turning 65 is if you're in a health plan through work that you want to stay in and you're going to continue working past 65, then you do not want to take A or B. If you have an HSA, then you can keep funding that account, stay in it. The only pitfall is when you decide to finally come off of that plan, either by retiring and now want to pick up Medicare, or for whatever reason, Medicare does a 6-month look back, and any money put in that account in the past 6 months is subject to income tax and that 6% excise tax. So you need to plan 6 months ahead of coming out of your HSA if you're in that environment. Now, confuse matters more, but it's not true for a spouse. So it's only the account holder. So if I'm the employee and I have an HSA, my spouse can have Part A and Part B, no problem, because I'm the account holder and I'm the one putting money in, or my employer is. It's just whoever is the account holder, that's the rule.
Okay. So we've talked about Part A and Part B. How do they work in terms of cost, in terms of coverage, in terms, excuse me, in terms of copays? Oh,
sure. Actually, I'm going to go to my next slide here to help cover that. So, that's the late enrollment penalty. All right. So, for Part A and Part B, original Medicare. So, in 1965, when this first came out, Part A is labeled hospital, if you remember from that card, but it's misleading because it's only covering room and board and services of a hospital. It's not paying doctors. That's covered under Part B. So Part A is just room and board, services of a hospital, so blood transfusions, skilled nursing. Only if you've had a 3-day hospital stay. You must be admitted to the hospital for 3 days before they'll pay for rehab or skilled nursing. And it carries with it, for 2020, a $1,408 deductible. So if you go to the hospital, the first $1,408 is on you. Then you have a limited number of days in the hospital. You only have 60 days in the hospital at no additional co-payment. If God forbid you're longer than that, days 61 through 90, you have a $352 per day copay. And if you're longer than that, you only have an extra 60 days. They call it lifetime reserve days to use throughout your entire lifetime, days 91 through 150, and you're paying $704 per day copay. Past 150 days, if you're in that straight all at one time, then your coverage ends. You're paying for everything. There's no more room and board, hospital, and services coverage. Part B, which is what covers everything.
Scott, does that restart with every admittance?
Yeah, there's a 60-day window. So if I go to the hospital and I paid my $1,408 deductible, I have that for that visit. It's a 60-day window. If I leave and then I come back, say a week later for something related, I don't pay the $1,408. It's part of it, and I'm in day whatever. It's up to day 60. It's all counting continuous. But past 60 days, then it starts all over again. Yep. And Part B, which covers everything else, that's what you're paying the premium for. That right now, $198 annual deductible and has a 20% co-insurance. So your Medicare is paying 80%, you're responsible for 20% of everything. So if you go to the hospital, you're paying the $1,408 deductible, the $198 annual deductible if you've not met that yet, and then 20% of the surgeon, the anesthesiologist, your family doctor comes in and says hello and bills Medicare, you're paying 20% of that conversation. And with Medicare, there's no maximum out of pocket. There's no limit to your 20%. So if you have a $100,000 hospital bill, you're paying $20,000 for doctor's side, the doctor's labs and all that stuff. So,
okay.
So because you have a lot of, oh, go ahead, I'm sorry.
No, go ahead.
I was say, and that's what we're here to talk about. You have options to help protect you from those costs, and that's what we'll go into in just a bit. But this is, some people think I get Medicare, I'm all set. Well, you're exposed to a lot of potential costs. So,
gotcha. So there were a number of pre-submitted questions that kind of nibbled around, wanting to know really the differences, fundamental differences, structural differences between Medigap supplements and Advantage plans.
Yeah, so let's, if anyone gets anything out of this, this is probably one of the most important things to understand, because anyone who's turning 65 or has already been or knows somebody, you get bombarded in the mail with all kinds of stuff, and it's very confusing. And unfortunately, even insurance companies use confusing terms and interchange these things. So no, thank you. I'll try to clearly explain the differences. So let's start with supplement plans. Medicare supplement plans are simply, they're plans that are designed by Medicare, CMS, which is the department that runs Medicare. They're designed by the government, and they letter them Plan A through Plan N. And you'll see a whole bunch of letters missing on the slide I just put up because they continued a bunch through the years. But all these different letters are sold by private insurance companies to help pay for part of the things that Medicare make you pay for. So for example, Plan A is at the lowest end of the spectrum, would be the lowest premium, but you still have to pay the $1,408 deductible, the $198 deductible, and there's some other costs that come through to you. The Plan F was at the highest end of the spectrum, where it covered everything that Medicare make you pay for. But of course, you're paying a higher premium for that than you would for a Plan A. And all these different letters cover various amounts of what Medicare make you pay for, but they're standardized. So this does not matter what insurance company you purchase this from, they're selling the exact same thing. A Plan A is a Plan A, Plan B is a Plan B, and so forth. So what separates them is they're free to charge whatever they want for it. And that's what really separates the different carriers. It's not regulated by Medicare. They can set their price, and they can change the price anytime they want to. So this is where you have to definitely be a consumer and shop between the various plans and plan options.
That's what I was just going to ask. On the Medigap, how important is it to shop around?
Oh, it's very, I can tell you, like in Cumberland County here, let's take a Plan G, for example, there's close to a $200 a month difference between the most expensive and least expensive for the exact same thing. So criteria I use when I look to see what carriers I wish to represent is because they can change the prices at any time they want to. It's typically I look for carriers that are stable over time when they're pricing, and no one can guarantee, but you look for over the past 5 or 10 years, what have their increases been, and what rate. And it tends to be the larger carriers. Why? Because if I'm a small carrier and say I come into Cumberland County and I sign up 300 people and I had 10 of them run up huge hospital bills, well, I can't just raise their rates. It has to be on everybody. So it's going to more likely I'll see a price increase quickly there, where if I'm a larger carrier, I have 10,000 people in a geographic area, I can absorb some of those losses. It's actually built in, so you don't tend to see it. But the point is, all Medicare supplement plans premiums will increase over time. But there's no networks or referrals for Medicare supplement. Doctors do not need to participate with your supplement plan, because what happens is you're going to show your Medicare card and your supplement. The doctor bills Medicare, Medicare pays its 80%, the 20% automatically goes to your supplement plan, doesn't matter what the carrier is, and depending on which plan letter you picked is going to cover all or most of that. And then you have a third card you're carrying for prescription drugs. What does make a difference, though, is when you first come onto Medicare, when you're brand new to Medicare, either by turning 65, or let's say you're 65 and you're going to work till you're 70, and then you're going to leave your employer plan and come onto Medicare. Same rules. You can, when you're getting Part B for the first time, you get what's called guaranteed issue. You can pick whatever plan letter you want with no medical questions. It's guaranteed. After you make that first selection, however, if you want to change plans, which you can do with supplements anytime, you can change every month if you want to. But next time you have to go through underwriting. They're going to ask you medical questions. They can pull your medical records. They can charge you more based on what they find. They can even deny you based on what they find. So unlike the Affordable Health Care Act, pre-existing conditions do account in Medicare supplements. Only the first time's guaranteed issue. After that, you have to go through medical questions.
And how rigorous is that underwriting?
They're usually looking for more major things. Of course, a cancer diagnosis, joint replacement diagnosis. If you've had a history of heart issues or pulmonary issues, or they'll look and they'll look and see how serious they think it's going to be over time, and they can either flat out deny you, or more likely, if you have some of those things, they might upcharge you. They might charge you more based on those. So when selecting a supplement plan, the idea is you're hoping to find a plan that you can just stay with. You buy once, you don't need to change it. And there's a reason for this, because otherwise everyone would buy a plan A, the cheapest plan, wait till they're sick, and then buy a plan F or G at the highest level, and then start paying then. That's, of course, the reasons for that. But so again, the important thing is if you find a carrier that they're all going to have increases over time. They rate these a couple different ways. Most of them are age banded, meaning they'll look at your age, 65-year-old male or female or 70 or whatever the age is, and they'll have their price. All of them at least once a year are going to have a price increases. But I've seen 2 price increases in 3 months with some of the small carriers if they had some big claims come through. So, again, that's something that's hard to predict, but it tends to be the larger carriers that are more stable.
Okay. How about the Advantage plans? Are they medically underwritten like the Medigap?
No, Medicare Advantage plan is a completely different thing, and this is where a lot of people, as I said, confuse the two. So Medicare Advantage, or now it's called Part C under Medicare, and prescription drugs is Part D under Medicare. So they actually added 2 new parts. So original was Part A and Part B in 65. In 2006, they added Part C and Part D. So we'll talk about prescription drug plans a little more later in detail, but Part D plans can be included in Medicare Advantage plans, which is why I have them together here. So Medicare Advantage plans, the whole concept behind this is it's just a different way of getting your Medicare. Is Medicare wanted to try to slow the cost of Medicare down. The #1 cost of Medicare is fraud, waste, and abuse. It's been over $1 billion a year. And what does that mean? It's not every doctor being crooks and stuff, although that does happen, where you have doctors bill for patients they never even saw, and Medicare is paying the bills, and it takes them a while to find that kind of stuff and catch that. The biggest part is actually waste, where doctors, they might order tests that aren't really necessary, and how does a patient know what you need to get done or not get done? If anyone's ever encountered a prior authorization when they needed something, that's the reason. The carriers want prior authorization, not because they're trying to stop you from getting a service or trying to stop the doctors from doing things that might not really be needed and help contain the cost of medical care. But so the government thought, well, how do we do this? And they said, well, when private insurance companies are very good at doing this, what if we pay them to manage people's Medicare? And that's all this is. They're contracting with private insurance companies to manage your Medicare. And they're paying them based on the county you live in. What Medicare did, they looked at their average cost in every county, and they came up with a number, and carriers are free to bid in each county. In every, let's take Pennsylvania, in each county will have a different price, and each carrier is free to bid and put a plan in that. It's a 1-year contract, so those plans are only good for 1 year at a time. That's why you've seen that enrollment period, October 15th to December 7th, that's coming up. That's the annual enrollment period to select a plan for next year. And drug plans follow this same pattern. So with Medicare Advantage, when the Medicare is paying a private company to manage your Medicare, but they have to follow Medicare rules. They're covering everything that Medicare Part A and Part B cover. It's not like each carrier is going to cover something different. So if it's a covered service by Medicare, it must be in their plan. Now, they might have different copays for the same procedure or something, but the rules are the same. So the advantage to this, pardon the pun, is because it's subsidized, because they're getting Medicare just by enrolling you, you have plans starting at 0 premium. You've seen this advertised, or people coming up to that season where you'll see these advertised a lot. And people often think, well, geez, it can't be any good. Why they're not paying any premium? How can they do this and make any money? Well, it's the reason why they're able to offer it is because, again, the subsidy. They're getting paid by Medicare just by enrolling you. And like all insurance, some people use it, some people don't. The ones that aren't using it, their money that Medicare's paying them is going to pay for the people that are. And so they're actually very strong plans, even the 0 premiums. So the idea between this and a supplement plan, and let me go to the next slide here as well. I'll come back to that. Is that rather than just shelling out premiums for a supplement plan where you're paying whether you go to the doctors or not, now I can get into a plan that doesn't cost me anything a month. I'm paying as I'm using services. I have so much copay to doctors, primary care doctors, so $0, $5, or $10, so much at a specialist, so much for hospital, so much for an outpatient surgery, so much for an x-ray, labs. All of things have copays. So the question is, would you be spending as much in copays as you would be just by paying premium so you don't have any copays? And for most people, the answer is no, which is why these are so popular right now. But don't misread. There is no right or wrong here. It depends on what somebody's goals are. The idea is with an Advantage plan is I'm paying as I'm going to be using services, so hopefully over time I'm going to save money. But no one can guarantee that. No one has a crystal ball. If we did this, it would be real simple. The idea of a supplement is, okay, I'm paying these higher premiums. I'm in a plan G, and I should come back to that in just a second. Actually, Plan G or Plan F. Or I'll use Plan F where you have no co-payments. So it's great. I'm not paying anything with other doctors, but I'm paying out a premium every month. So so whether you save money or not actually will depend on what your health is. So Brett, let me back up to the supplements real quick, because this is another confusing thing that I get asked all the time. Plan F, which was the highest level, and if I should go back to that slide real quick, is going away, but only for those that are turning 65 past January 1st, 2020. If you were 65 prior to January 1st, 2020, you can still buy a Plan C or Plan F. Past January 1st, 2020, you're turning 65, Plan G would be the highest level you could buy. And it's very similar to Plan F. The only difference is you have to pay the Part B deductible, which right now is that $198. I just want to make that quick distinction because I do get asked that a lot.
So just kind of continuing to compare and contrast the Medigap supplements and the Advantage plans, what's it like? You had talked about when you move from one Medigap supplement to another. What if you want to move from one Advantage plan to another?
Yes, and that's a great question. So Medicare Advantage plans, because they're only 1-year contracts, when you go to change each year, they're guaranteed issue, meaning you have no medical questions except for one, which right now it's end-stage renal disease. That's kidney failure, kidney dialysis. If you're in that category, or God forbid that happens to you, you can pick any, you could have to stay with the insurance company you're with. You can pick any plan they offer, but you can't leave that carrier. Other than that, that's the only stipulating of diagnosis right now that would box you in a little bit. And I understand actually that's going to be going away for next year. From everything I'm seeing and reading, they're going to do away with that, which I'm happy with. It'll make things even easier. But other than that, again, each year when you go to change, because you don't have to answer medical questions, you can change as you need to. So I guess the best way for me to explain this is just through actual example. I have lots of clients that fit this bill, but one in particular just worked out timing wise. I have a gentleman, he started in 2006 with a zero premium Medicare Advantage plan. In 2016, 10 years later, I got a call from his daughter because she was all upset. He had developed cancer, he had some surgeries, he had some chemo, he had spent a little over $4,000 in co-pays. That plan, by the way, had a maximum out of pocket of $6,700. All Medicare Advantage plans do have a limit to your wallet of how much you can spend in a calendar year. But he's at a little over $4,000. And she was upset because she said her mother went through cancer and never had to pay a dime. Well, her mother had a supplement plan. She had a plan F through me, so she didn't have any co-payments. So after I explained to her, I said, but your mother in those 10 years spent over $22,000 in premiums. Your dad spent nothing in 10 years. He only went to the doctors a couple times a year. He didn't spend $50 a year in his health care. So this $4,000 is the first real money he's had to spend. Now, but now knowing that he's battling cancer, this was in May. That October 15th, December 7th, we switched him to a plan at the time was $50 a month, had a maximum out of pocket of $3,000. So the most he could spend is $3,000. As it actually turned out, for 2017, he didn't quite hit the maximum. He got close, but he did get cancer free, and then went back to a zero premium, which is where he is today. So you can change based on what your needs are for that year. You're not trying to decide what health plan do I need the rest of my life. I take it year by year, one year at a time, and that's pretty powerful. Because again, as far as containing cost, you can be a little bit more in control, other than just paying out those premiums so you don't have any of the co-payments. So that's probably the best way I can illustrate that.
Yeah, that's a great example, because we see that all the time where, circumstances today are not going to be the same as they are in 5 years, 10 years, 15 years, and you've got to adapt as they evolve.
Absolutely.
So Scott, tell me just a little bit, are there any notable differences between the two, the Medigap supplements and the Advantage plans for prescriptions?
Okay, yes. So Medicare supplements by law cannot include drug plans. So if you do a supplement, you must buy a standalone prescription drug plan to go with it, which follows this same year contract, and you have to change that each year. Medicare Advantage plans are allowed to include drug plans in them, and they're also allowed to include other things like dental, vision, gym memberships. And that's really what you see the carriers advertise heavy on those. But really I look at those as like added bonus things, but because you're really buying a medical plan, you want to make sure that fits, and then start separating between all the different carriers. You start looking at the other things that they're offering as really, unfitting you. But buying one just because it contains a dental plan is like, okay, as a dental plan, what are you paying for everything else, your prescriptions, co-pays, and so forth? You could end up spending a lot more, and that's what the confusing thing. So they're all, again, following the same rules, but there are differences in that. Now, whether they have a drug plan in it, there are some Medicare Advantage plans that don't have drug plans in it. Like if someone's a veteran and they're getting their medications through the veterans, they don't need a drug plan. You can find them without a drug plan. If you get one with it, though, you can use both. You can use whichever's cheaper, so you're not precluded.
Okay. And I know there's, we talked about this a little bit before, just you and I, before the webinar, that there's really no simple answers. It's not like there's a flow chart and it all gets worked out. But do you have a general sense as to the cost differentials between the Medigap supplements and the Advantage plans? If one is typically more advantageous than others, or maybe a different way of looking at it is if you did kind of a weighted matrix, a decision-making matrix, where would cost fit into it?
So that's another good question, kind of complicated. So what I do is what we at AIA, what we do is we try to license with the majority of carriers in an area. We cover the state of Pennsylvania. We have some other states that we cover as well. So when we sit down with somebody, we try to educate them to the differences and help someone decide, because there is no one right answer. And even a husband and wife could be in two different types of plans based on what their needs are, based on what prescriptions they're taking. And of course, most people pick plans based on what a friend or relative has, because it's confusing. If you want to find someone you can trust, you'll say, so what does Uncle Charlie have? And okay, this is great, get that plan. Well, it might be great for him or her or whoever you're asking, but doesn't mean it's the right one for you because everyone's taking different medications, different lifestyles. Do you travel? Do you not travel? Do you travel internationally? All these can factor into what the right plan for you is. And it really is an individual thing. And it's really difficult to do this yourself. I mean, because if you ever have seen advertised, the carriers, they'll advertise seminars you can go to, but they're only going to show you what their products are. They're not going to compare theirs to the next person's or next carriers. And it's, so what we try to do is sit and explain, educate somebody so they can make an educated decision about what's best for them. And you're right, it's like a matrix. I equate it to a puzzle. It's, you have all these different puzzle pieces that factor into what's the right plan for you. And it is often is the case, it's different for a husband and wife even. It's like the prescriptions and what doctors networks, and do you travel? Do you have a vacation home somewhere you spend 3-4 weeks or a couple months where you might need to care down there, and do you need a plan to be able to work down there? All these can factor into that. And of course then budgets at the end as well.
Scott, you just mentioned the foreign, and there were two pre-submitted questions that kind of deal with that. One is, and bear with me, I live overseas. If I get sick while overseas but return to the US to continue treatment, will Medicare help? And then I think also indicating eligibility criteria for a 74-year-old US citizen through naturalization who has no history of working in the US.
Okay, well, I'll do the international question first. So Medicare itself, has no coverage for out of this country. It's only United States. That's it. Now, supplement plans like a Plan G does have international coverage. You get up to $50,000 of lifetime coverage, but you're paying 20% of it, and they're paying 80%. You have $50,000 max throughout your entire life. Medicare Advantage plans, and they differ. Some carriers have, there's one carrier that has an unlimited amount of international coverage. So I have clients that travel internationally a lot, and yes, you can buy medical coverage when you travel international, but you can have your Medicare Advantage plan have it built in, and they have varying amounts of different amounts. So some people use certainly for that. And I forgot the second part of the question was,
eligibility criteria for a 74-year-old US citizen through naturalization who has no history of working in the US.
I don't know if they've contacted. I would encourage them to contact Social Security because these laws are constantly changing on what they're allowing to come in. So I would encourage them to contact them.
Yeah, and then there was one other. If the drug prices paid by Medicare become the same as those in Europe, will that impact us?
Okay, become the same as Europe. Oh, so under whether you get a standalone drug plan or you get one built into Medicare Advantage plan, depends on which medications you're talking about, because most of the maintenance generic drugs are zero in copay. You're not even paying for them in most of the Medicare Advantage plans, or they're certainly low, $3, $4. I mean, they're not high cost. The one, and we'll get to the drug plan section in just a second, I guess more detail, but it's a hard question to answer. Actually, it might be better when I explain how the drug plans work. It might be better time for me to answer that question at that time. Because
why don't we talk about that? Just how do prescriptions and prescription plans, how do they factor into the overall planning?
Perfect. All right, let's do that right now then. So this chart that I just put up, this is how drug coverage works, and it doesn't matter if you get a standalone drug plan or you get one that's built into a Medicare Advantage plan. The stages are the same. So the first stage is a deductible. If your plan has a deductible in 2020, the highest it can be is $435. These numbers you see in red, blue can change every year, but this is what it is for 2020. I will make a general statement saying most standalone drug plans have deductibles. Most plans that are built into Medicare Advantage plans do not have deductible, but either if your plan doesn't have one or you've met your deductible, then you go to stage 2. Stage 2 is initial coverage. That's where they take each medication and they'll put it into a tier. You may have heard this. Tier 1's preferred generic, Tier 2 is non-preferred generic, Tier 3 is preferred brand, and you have non-preferred brand specialty drugs. So most plans have 5 tiers. The trick here is each carrier is free to take any drug and put in any tier they want to. So just because you're taking a generic, a company could build out like a brand. They take a brand and build like a generic. This is where the puzzle begins. So one of the first things I do when sitting with somebody is I analyze as we take your medications, we compare against every plan out there, who's got your drugs the cheapest. You start there. And then from there, you look at doctors, networks, and so forth. Now, Medicare does not regulate the cost of these drugs. Each carrier is free to negotiate their own pricing for each of these drugs, which also separates the carriers. The only thing Medicare does say is each formulary that's put together, so each drug plan must cover at least 2 of every therapeutic category of drug. So no matter what drug plan you pick, there's going to be something on there that the doctor can prescribe that's covered in the plan. But what tier is it in? How much are you paying for it? That certainly is the question that can change. So stage 2 is where they set up and what you're going to be paying on your monthly basis for each medication. Now, Medicare is tracking the total amount of money being spent on you for medications. And if that reaches $4,020, that's what you're spending plus the insurance company, not just you, the total combined amount. If it reaches that $4,020, now you're entering stage 3 of the coverage gap, or it's also known as the donut hole, if anyone's ever heard that term before. What that means is your coverage changes. Now, it used to be in 2006 when this first started, the reason why they called it the donut hole is because your coverage actually ended. You had no more coverage. You had to pay the full cost of the drug, whatever that was. Now you're paying 25% of the negotiated cost. So whatever for a brand or a generic. So whatever the carrier negotiated, you're going to pay 25% of that. And you're going to remain in that coverage gap until, these are all calendar years. So until either the end of the year happens, then January 1st, it starts all over again. Or if just out of your pocket, not the insurance company's, just yours, you spend $6,350, you enter what's called the catastrophic stage. And when you do that, you'll pay $360 for a generic, $8.95 for a brand, or 5%, whichever is the higher amount. And there you will remain until the end of the year, and then January 1, it starts all over again. So let me just quickly try to illustrate it because this gets really confusing. Let's say I'm taking a whole bunch of medications. One of them's the carrier negotiated a $400 full cost. That's what the carrier negotiated. I'm paying $50 a month as a tier 3 drug. They're paying $350 a month. So then I'm going through the year, and at some point in the year, all my drugs now add up to $4,020. Now I have to pay 25% of the negotiated cost for all my drugs. So in my example, that $400, 25% of that's $100. My cost just doubled. I was paying $50 a month. Now in stage 3 of the coverage gap, I'm paying $100 a month. And again, I'll remain there until either the end of the year or going back to the beginning of the year. If just out of my pocket I spend $6,350, then I enter the catastrophic stage. The only good news here is, little bit good news here is, while I'm paying 25% of the negotiated cost, 85% of the cost counts towards that $6,350. So in my example, 85% of $400 is $340. So even though I'm only paying $100, $340 is actually counting toward that $6,350 to help me get there. Now, people don't need to memorize this. This changes every year, but this is all calculable. This is something that we can sit down. I can tell you if you're going to hit it, when you'd hit it. One carrier might put you in where another one doesn't because they negotiated different pricing of drugs. And of course, this changes every year. Each year, the deck completely reshuffles. Just because the carrier covered your drug one way one year does not mean they're going to cover it the same way next year. You have to look at this. Is nothing you can just buy and forget. You need to analyze this year after year. So even if you do a supplement plan with a drug plan, you still need to do this for the drug plan. If you get a Medicare Advantage plan, well, of course, you're reevaluating everything year after year.
You answered my follow-up question, which is, this is something you've got to look at, every single year to determine how, your drugs changing will impact it, how the plans changing are going to impact it. It's really fluid.
Completely. And this is, as I said, this is where a lot of people will fall short, or they might get it analyzed one time one year and then just stay with it and just never change. Well, odds are you're going to be spending more than you have to, because the system's changing on you, whether you're looking at it or not. And the other thing I want to point out is a lot of people will come into this with either carrier loyalty because they have been with this, this company since I've been working and they're great. Medicare's a different world. It operates differently because all these carriers, and I'm talking now the medical side, they're just managing your Medicare. They're not. It's not like one carrier is going to cover something the other one doesn't. They're operating under Medicare rules. So it's really finding the one that fits your needs for that year. That's really the goal. And you know, as I said, that's difficult to do on your own.
Scott, would you say that most people really, really understand, you know, number one, their ability, and number two, the importance of reviewing this on an annual
No,
basis?
no. I mean, you know, again, you get information overload because you're bombarded on television, you're bombarded on the mail, and it's just, you know, it's just, you don't know what to do. Plus, unfortunately, most brokers don't license. They'll license with 1, 2, 3, maybe 4 carriers. They're only going to shoehorn you into what they have. So what we try to do as a goal is we license with as many as we can. I can't always say I have them all, but even if it's something that we don't have, I help people get it. I will help you analyze this so you understand. We'll help you find whatever the right thing is for you. We don't charge fees for what we do either. We're only paid through a carrier enroll through us. But the you know, our goal is to truly get out and help people understand this, because it's a lot of people are spending a lot more just simply because it's confusing and no one's really taking the time to really sit down and help them understand it.
Yeah. So here's a question that somebody had asked, is going way back to the very beginning of the conversation when you were talking about the impact from earned income. So the
Yes.
question is, how is it that Medicare can look at earned income from years prior to starting Medicare?
Well, that's because a good question. It's the main reason is that the reason why they go back 2 years is because you obviously, some people could delay their filing from the current year, and so they'll pull the first tax return that they have available to them. But that is what they go by. And then, as I said, if your income is going to be different than that this year, then there is an appeals process to get that straightened out.
Okay. So it's an across the board thing. It's not that everybody is operating under the same rules.
Everybody's operating the same thing. Yep. And
All
once
right.
you 2021, they're going to look at your 2019 tax return. That's
okay.
2 years back.
Just how it is.
Yep.
Okay. And then this is a more specific question. Why enroll in Medicare Part D drugs if you have drug coverage with a Highmark Medigap plan?
Well, Medigap plans are not allowed to include drug plans. So supplement plans cannot include drug plans. Only Medicare Advantage plans are allowed to include drug plans. So you can't have a Medigap plan with drug plans included. That's illegal. So all supplement plans do not have drug plans built into them. So the person that question might be confused. They might have a Highmark Advantage plan that can have a drug plan in it. So, because most Advantage plans do have drug plans in them, but supplements do not.
Okay. And here's another, this is on the Medicare Part B and Part D surcharges. The 2-year look-back provisions, I guess they're asking, do the 2-year look-back provisions start with the year that you start Medicare?
The 2-year, wait, so the 2-year look-back, you mean what their income is?
I believe so. It
Yeah,
starts 2 years prior to the year that you start Medicare.
Whatever you're turning 65, whatever year that is, you have that 7-month window. So let's say I'm turning this October. They're gonna look back at that 2018 tax return. That's what they're gonna go by for income.
Okay.
It's whatever the year you're in. They're going back 2 years. Am I answering that question right? Or did I maybe misunderstand it?
I think so. I think so. Yeah.
Okay. Good.
So,
yeah. So that's that. Again, when you apply for Medicare through Social Security, and this happens a lot, just so anyone in the higher income brackets, that you'll first get a letter. This happens all the time. Oh, your Part B premium is going to be $144.60, and then 2 weeks later you get a letter. Oh, because your income, you're now going to pay an additional $300 and something a month. It usually comes separately, but so just knowing ahead of time, if you know what your 2018 tax return is, that's what they're going to look at. So once you get that additional letter, if you can dispute that, if you say, okay, well, look, that was my income then, but it certainly isn't now, then you can try the appeals process and fill out on a form.
All right, and I think maybe, here, bear with me.
Mm-hmm.
Somebody wrote, my question was not understood correctly.
Okay, good.
While overseas,
all right,
and then return to the US, will Medicare cover me? So that was back when we were talking about the foreign.
Oh, yeah, yeah. So someone has Medicare, they're overseas, then they come back?
Yes.
As long as they still have Medicare, absolutely. Yes. As long as you still have Medicare. Yeah.
And here's an interesting question. If Obamacare, the Affordable Care Act, is repealed, what would be the impact?
Okay, good, very good question. So, I'm certainly not getting political, but the Affordable Health Care Act, the way that it impacted Medicare actually never really fully happened. What it was supposed to do is, remember what I said with Medicare Advantage plans, how they're being paid by Medicare just by enrolling people, just that it's subsidized, are getting money just to manage it. Well, the Affordable Health Care Act called for them to pay Medicare less over time. They're going to get less and less. They're going to pay, I'm sorry, Medicare's going to pay the carriers less. So that means the prices were going to start going up on Medicare Advantage plans. Well, that never happened. Actually, they started increasing over time. And it's a seniors big voting block, and I guess politically, but they never enacted what the law called for. So, so right now, if it was repealed, it would probably have zero effect. I mean, what they're paying each carrier is determined each year. They decide it in February. The final release is usually in June, and so the carriers can start submitting their plans in June. They have till October 1st to finalize them, so that's why legally I can't even talk about next year's plans until after October 1st, and then you can enroll between October 15th and December 7th. But I don't see a huge impact on what happens with the Affordable Health Care Act at this point. It certainly hasn't had one, even when the law called for them paying less. We have not seen that.
Okay. And here's a question that just came in regarding, we were talking about HSAs, health savings accounts earlier.
Yes.
They asked if you can fund the HSA for the months prior to starting Medicare in the year that you turn 65.
Yes, because prior to 65, they can't penalize you or they can't look back 6 months because you weren't even 65 yet. So before turning 65, absolutely, you can put as much money in there as you want to. And then when you finally then go on to Medicare, then you can no longer fund that account, but you certainly can use that money for under Medicare Advantage. You can use it for co-pays, premiums, anything like that. Supplements, you can't use it for supplements premiums. That's against the law, but you can use it for Medicare Advantage premiums and co-pays.
Okay.
Or even other things that Medicare doesn't pay for, like Medicare doesn't pay for routine dental and vision. You can use of course, your HSA money toward that as well. Anything the IRS says is medically allowed.
Okay. And this is a question that I think might be pretty common. They're asking if you split your time between residents in different states, is there an advantage of a Medigap versus an Advantage plan?
That's a very good question. Actually, so your Medicare looks at wherever you spend 183 days a year, that's where you live. So that's by their definition. Now, it also falls to where you're filing taxes, where's your driver's license, what's your main residence. So Pennsylvania happens to be, we rank between second and third most seniors for a state. Between us and Arizona, battle back and forth. Florida has the most. But our plans are very rich here. We have a lot of options. We have a lot of good plans. If you say go to Maryland, like I'll give an example. So in Lancaster County, you have 63 different Medicare Advantage plans to pick from. In Cumberland County, you have 50. In York County, you have 53. In Maryland and Baltimore, you have 6 total different plans to pick from. So depending on, there are some states that do not have as good options as other states. So if you have control over whether you want to call home, then yeah, there can be a difference, absolutely. But that's really what they're using, is that 183 day.
And is it safe to assume that where you file your state income taxes is the state that you would be using?
Yes, absolutely. It's hard to say I live somewhere else, but I'm filing taxes in another state. So yes. So typically I do, and I have a lot of clients that actually have some that have changed. Now, Florida, if you're moving to Florida, because they're also a very rich state with a lot of plans, I should say. That's what I mean by rich. They have a lot of options and low cost options. So generally, you're good to find something there as well.
That was going to be my question, because I know a lot of people try to get Florida as their primary residence for state income tax purposes, and to find out, how they did on this front that would one sway. You're going to get the best of both worlds.
Yes, you are. Yeah, I can't say for every single county. I ran into one county who was helping somebody that we had more options than they did, but most of the counties, that's not true for Florida.
Right.
Most they're on similar ground. So yeah, you're safe. But there are some other states that have very little, because remember, it goes to what the population is, how much risk are they spreading for the insurance companies. The more population have risk spread, the better the plans are going to be, lower the pricing to somebody and so forth. So
Right, going to be tougher for Delaware and Rhode Island
right,
than
right,
Pennsylvania, Florida,
exactly,
Texas. Yeah,
exactly.
gotcha. So, and I think this question is asking the supplemental and advantage plans, if they end at year end, if their contracts end at year end. Oh, I'm sorry, no, can I switch back and forth between supplemental and advantage plans at end of year contracts?
Very good question. I'm glad they asked, because I definitely want to cover this. So when Medicare Advantage plans first came out in 2006, Medicare put two rules in because everyone was scared to death of them. It was brand new. They didn't know how it was going to work. They didn't know. I mean, they were attracted by the low cost, but they weren't sure how it would work. So Medicare put two rules in. If you're just turning 65 and you go into Medicare Advantage plan, you get a 1 year free look. You can try a Medicare Advantage plan for a year. If for any reason, anytime during that year, you decide, this isn't for me, you can go back to a supplement guaranteed issue with no medical questions. That's the key. Likewise, if you've already been on a supplement plan and you want to try a Medicare Advantage plan, you'll also get a 1 year free look. When you leave that Medicare Advantage plan to go back to a supplement, you are going to go whatever the current pricing is, which sometimes actually is lower, believe it or not, than what they're currently paying. So there's been a benefit to people doing that. But yeah, so you can, but after that first year, then no. If you want to change back to a supplement plan, you have to go through underwriting after that first year. So Advantage plans, again, you can change once a year. I skipped over that other slide, but there is another. They brought back an open enrollment period from January 1st to March 31st, where you actually can make another change, only on an Advantage plan though. So, and then after March 31st, then I'm locked in for the rest of the year. And let me explain that real quick. So let's say I help somebody in October and we pick a plan. It goes into effect January 1, but then February, your doctor adds a new prescription and the plan you're in isn't covering it, or they're not covering it low enough. But we have another window, we can make another change. Or let's say, God forbid, you had a diagnosis of something serious and I know I'm going to need a lot of medical issues, and I could get another plan to Medicare Advantage plan that's now I'm going to pay a higher premium, but it's going to help lower my total cost, either by lowering the max amount of pocket or lowering the copays and so forth. So you have another window to change. Supplements, as I said, you can change anytime you want to, but only the first time is guaranteed issue. If you want to change again later, you have to go through that underwriting. Advantage plans, you do not.
All right, so that flows very nicely into another question. Those were more about changing from, within Advantage plans or within supplement plans. This is a little bit more about if there are any recommended criteria for selecting or comparing an Advantage plan versus a Medicare supplement plan.
Is there, I'm sorry, repeat the end. Is there, comparing them?
I guess, is there any criteria you would recommend for selecting or comparing between supplements and Advantage plans?
Yeah, I mean, the real difference is, if you explain it, and there's two different ways of getting your Medicare benefits. One, you're going to be paying a set, initially you'll have a price. So let's say I did a supplement plan. Let's say I got a plan G, it was $130 a month. I'm just picking a number. And I'm paying $20 a month for a drug plan. So I'm paying effectively $150 a month. So that's $1,800 a year, whether I go to the doctors or not. 10 years from now, that same thing is going to be $250 or more, which means over 10 years, I'm going to spend $25,000 to $30,000 in premiums. Compare that to a Medicare Advantage plan. If I just start off with a zero premium plan, let's look at the first year. Would I spend $1,800 worth of copays in the calendar year? For most people, not even close, which is why they're so popular. Because even on some of those plans, if I go to the hospital, they can be low cost, $300-$400 or something for a stay, or I mean, there's different ones. I don't know what counties everyone's in, and it's hard to speak in generalities, but it'd be very difficult to spend that unless you had a lot of hospital stays, a lot of issues for that. Now, if you know year after year you have a lot of medical issues, or you're concerned of family history, or I've had people, if you sleep better at night knowing I don't have copays, then supplements are great. I mean, because you other than plan G, other than the first $198, everything else is going to be covered. I've had multimillionaires, zero premiums, advantage plans because a dollar is a dollar. They can afford anything. I've had people barely afford it, prefer supplement because they just don't want to have to think about copays. Only an individual can answer that question. There's no right or wrong answer again. And I can't stress that enough. This is truly, and most people are asking friends and family, hey, what do you have? And that's where most people are picking, but everyone's going to have a little bit different answer to that.
Yeah. We're pushing up on about 1:30 here, so we've got just a few more questions that we'll kind of try to field here. One is asking, they have a traditional Medicare, but not Part D. Can they add the Part D without penalty?
Okay, so the answer to that, it depends. I'm gonna go back to the latest. So here's the slide for Part D. So they calculate it when you're first eligible for Medicare. And I told you, remember, you get that 7-month window. If you go past that, you're paying 1% of the national average premium, which right now is $32.74. 1% of that for each month you went without it. So it depends how long it's been. Now, if you've had creditable coverage, if this person answers the question, they've had no other drug coverage and all they had was Medicare, which when this first came out in 2006, a lot of people did, because they're saying, well, I'm not taking medications. What do I need a drug plan for? Well, turns out if you didn't get one, you're penalized later. And so if you go 5 years, say, without since you were first eligible, that's 60% penalty. So you're paying 60% of $32.74 for the rest of your life every month. And as that average premium changes, so does your penalty change. So to answer your question, yes, you can still get a drug plan. Depending how long it's been, you would be looking at a penalty, but it still might be cheaper to face and take the penalty than just having to pay the full price of your drugs the rest of your life. So that's a person I definitely encourage to call, and we can sit down and calculate exactly what it looks like, look at what their drugs. Now, again, some people, if you're getting your drugs as you're a veteran through veterans, or if you're on real low income, there's PACE and PACEnet is a state lottery. What the state lotteries pay for. It's a program for people that are 65 years old or over. If you're a married couple, make $35,500 a year or less, or a single person make $27,000 a year or less, you can qualify. It can help cover drugs. That's another way you can get around this. I was just trying to give some other alternatives out there without knowing all the facts.
Gotcha. And this is maybe a related question, Scott. They ask if working past 65, covered on their employer's plan, or covered on a spouse's plan past 65, is there a Medicare penalty later?
No. So you can be covered under yours or a spouse's as long as that coverage is creditable, which again, most employer coverage is. Past 65, as long as they have more than 20 employees. Remember, that's also the cutoff. Got to make sure they have 20 or more employees. But as long as they fit that bill, you can stay on that plan as long as you want to and pick up Medicare with no penalties for Part A or Part B or Part D prescriptions, assuming they have a drug coverage in their plan.
All right. And then, Scott, I think we'll wrap up with this one. And this is pretty specific, I think. They indicate they're 68 years old, have coverage through their spouse's plan. I think it said PA Courts, which is a Highmark plan. They were told they should not enroll in Medicare. Is that accurate?
Okay. Yeah. So when it comes to retirement plans from companies, either the state of government or federal government or teachers or unions or any of this kind of stuff, you start getting some unique animals because they're allowed to put together their own types of plans. Some are even quasi supplement advantage plans. I've even seen mixtures. They're allowed to write it how they want to. So it's still worthwhile comparing to the open market. But some of the plans, and did you mention, was this a federal, did you say? Was this judges, did you say?
Well, it said PA Courts, so we'll say Commonwealth.
Yeah, so some of these plans have their own without you needing to get Medicare. They just have their own retirement plan. You don't need to go on Medicare. And so that's totally possible. We're seeing less of that as time goes on. As a matter of fact, most companies are increasing their cost at the open market is actually cheaper than what they're offering in retirement. A lot of people think, okay, I'm retired to this company, I'm just going to say what they have. I'm finding more and more that they actually can do better. But again, that's something I can help you with, and will always help you figure out what's best. If the company's plan is better, then definitely go with that. If you can do better elsewhere, it'll become apparent as we go through it.
Okay. And there was just one final question that I'll tackle,
Yeah.
and they asked that I think with some work constraints, weren't able to really focus on this as much as they would have liked to.
Oh.
Wanted to know if we're going to put out a replay or a link for the seminar, and we absolutely will. So
Okay.
this will be something that people will be able to go back. I'm not quite sure the time frame of it, but I would imagine within several business days we'll be able to have excuse me, a link of this that people can replay. But I think with that, I'm just gonna, Scott, thank you very, very much for your time, your expertise, for being able to share some of this information with us. Based on the volume of questions and the turnout that we had, it obviously is a very topical issue, and something that's definitely on people's minds.
All right.
But if there's any follow-up questions, please don't hesitate to reach out to either of us.
Yeah, please. I'm happy to answer anyone's questions. Call me. I'll be happy to go through your individual situation.
Yeah. And with that, Scott, I'll kind of close out there, and thank you again for your time and expertise.
Oh, thank you, and thank you to Roof Advisory and Fort Pitt Capital for letting me do this. I really appreciate it. Thank you.
Yeah, it was our pleasure.
Thank you.
Thanks so much to everyone. Have a great rest of your afternoon.